So I was asked a question. A patient who has facet effusions, some gapping of the facet joints at L4-5, but no instability on flexion extension. Symptoms are back pain, which, it's unclear the type of back pain because I didn't see the patient, but it sounds like it's probably mechanical axial back pain, but also some numbness in the feet. And so the question is, would they benefit from a fusion, given the fact that there's no instability, but there is gapping of the facet joints and some effusions of the facet joints? This is a really tough question. It's a great question, but it's a really tough question to answer. We would need to know, importantly, the history of what conservative things have been done. Was there attempts to do physical therapy? Had they tried medial branch blocks and radiofrequency ablations to see if that alleviates the pain? When is the pain worse? When is the pain better? Is it worse with activity, sitting or loading the spine, and better with lying flat? What does flexion extension do to the pain? And then, what other core stabilizing exercises were done? I would really like to see a CAT scan, and I use CAT scans on every patient that I'm considering a fusion, because it really gives invaluable information on the bone architecture, on the facet joints themselves. How do the joints look? Are they sclerotic, or are the margins of the facet joints well marginated? It also offers good understanding of the disc osteophytes that could be there, any calcifications of the disc. So CAT scan is very important. Flexion extension x-rays obviously are important. If there's no motion, then it's unlikely that there's instability, but we have seen dynamic MRIs used. I don't think they offer a tremendous amount of information if flexion extension films are really completely normal in terms of a minimal, 1 millimeter, let's say, movement. It's a very, very tough question. I would really want to know how the pain was after facet blocks were performed and possibly a medial branch block. And then I'd want to know that they've tried core stabilizing exercises, things like yoga, and if the pain was improving or worsening with those type of exercises. Doing a fusion like that with kind of normal disc, normal height, no instability, really not something we like to do because the outcomes really are not phenomenal. But like I said, I would need to see more images to really make that decision.